Good evening. Tonight I'm going to talk to you a little bit about allopathic versus osteopathic medicine. In this presentation, you're going to learn a couple different things. We're going to talk about the medical definition, the similarities between both practices, the unique differences between the practices, and then we're going to discuss a little bit of the preference, or you're going to decide as a student or as a patient which type of care you'd like. There are two types of medical practicing physicians in the United States. There's the allopathic physician, or the traditional doctor, or MD, and there's the osteopathic physician, or the DO. It's good to note that with both of those practices, they have the same level of legal benefits. They both are fully accredited licensed physicians. They're both trained to diagnose and treat illnesses in identical ways. And also that state agencies recognize both degrees as equivalent. When students are trying to be physicians, they are encouraged to receive both training in order to familiarize themselves with each and have a broadened educational experience. Now we go into the differences between the two. The definition of allopathic medicine. Allopathic medicine, according to Merriam-Webster, is defined as a system of medical practice that aims to combat disease by use of remedies, as drugs or surgery, producing effects different from or incompatible with those produced by the disease being treated. A system of medical practice making use of all measures that have proved a value in treatment and disease. So, with allopathic medicine, you have an MD or a traditional doctor. They use a modern approach to medicine. Basically, with their care, they emphasize with modern medicine chemically derived, which means they prescribe medication more than what an osteopathic doctor would. And last, they use monitored care with modern technology. Then we go on to the definition of osteopathic medicine. Osteopathic medicine, as defined by Merriam-Webster, is a system of medical practice based on a theory that diseases are due chiefly to loss of structural integrity, which can be restored by manipulation of the parts supplemented by therapeutic measures as use of medicine or surgery. So then, with the type of doctor that we have, osteopathic medicine, you have a DO or a holistic doctor, one that uses more of a hands-on approach. You have a doctor that's more concerned with a healthy lifestyle, and they're more emphasizing on preventative treatment. And lastly, they allow the body to heal without the overuse of medication. This does not mean that they won't prescribe medication. It just means they will do everything to have your body heal in the most efficient way possible without using medication. So then when it comes down to it, pretty much you decide whether you're the student or the patient, which type of preference or type of medicine or doctor that you'd like to go with. As the medical student, as the patient, you're going to pretty much decide whether you want the traditional or hands-on approach, or you want the holistic approach, and then pretty much you're going to go along with what you think you need medically as a patient. Thank you all for listening tonight. This last page here is my references. I hope I was able to add some insight into the differences and of allopathic and osteopathic medicine. Have a good evening. Thank you.